Alrighty, ladies, welcome. Thank you so much for tuning in to Glow Up, Level Up. Tonight, I am going to be talking about everything brushes. You're in for a real treat, and we thank you so much for tuning in.
Raise your standards, and the universe will meet you there. Self-care is giving the world what's best of you, not what's left of you.
Life is too short to wait.
When you know better, you'll do better.
Raise your standards, and the universe will meet you there.
Because when you glow up, you level up.
Level up.
Glow up, level up.
Level up.
When you glow up, you level up.
When you know, you will grow. Join us on glowuplevelup.com for a series on how to take care of you. Alrighty, well, welcome again. My name is Dr. Elizabeth Ottey. I am the founder and creator of Glow Up, Level Up. I created GULU because I wanted to provide a platform to encourage and promote holistic growth for women by providing access to experts in the health beauty industry to learn, to grow, and glow up. A little bit about myself. I was born and raised in Burlington, North Carolina. I'm married to Dr. Orby Ellis Ottey Jr. I attended Meharry Medical College, where I graduated in 2017. I am currently a third-year orthodontic resident at the University of Maryland, Baltimore. I'm graduating in 30 days as of tomorrow, so I'm super excited. Recently, I was awarded the Presidential Core Value Diversity Award, which was the first time that the university had this particular award, and really honored. And in my free time, I love spending time with my family and friends. I love singing and mentoring our youth. And one of my favorite Bible verses that I live by is to trust in the Lord with all thine heart and lean not unto thine own understanding, in all thy ways acknowledge him. With that being said, I briefly just wanted to say that with everything that's going on with the media, I know there's a lot going on. And so I'm not surprised that a lot of people aren't tuning in right now because they're upset, they're angry of everything that's going on. And I feel the same way. I have done my part. I believe I have signed petitions, and I'm still signing petitions every time I get an email or a notification. I'm doing my part because I want the world to know that Black lives do matter. So yes, Glow Up, Level Up supports the movement, and we hear you, we see you, and we're praying for everyone's safety and that there's justice for all Black lives. So let's get into what I'm going to talk about tonight. This is just a series on just brushes. I have so much information I want to share with you ladies to help you glow up. But let's just talk about brushes. Why do we brush? When do we brush? What are the types of brushes? What are these companies, and what is everything all about? So I want to talk why, how, when, and where. So objectives, I want you to understand why brushing is important, understand the importance of fluoride, the do's and the don'ts, the recommendations, the different types of brushes, manual versus electrical or power, and then inform you about the different brands on the market. Now, why should you brush? You really want to brush to prevent cavities. You need to remove this plaque from your teeth. I know this picture on the right is super disgusting, but this is exactly an exaggeration of when you do not remove plaque from your teeth, what can happen. So how you remove this plaque off your teeth, you must brush. Okay, brushing also will stimulate the gums and help keep the gums healthy. In this picture, you can see here the gums are pink, they're red, and they're inflamed. And this is not good for your health overall. So how to brush. I have a little brief video that I wanted you guys to take a look at. The ADA made this video, and I wanted to show it because it's only a minute, and it just goes into a little detail about exactly what it means to brush and how to brush.
To keep your mouth healthy, it's so important to brush your teeth for 2 minutes twice a day. Here's how to do it right. Place a soft bristled brush at a
Can you guys see my screen? Yes.
45-degree angle to your gums and move the brush back and forth in short strokes. Not too hard, use gentle pressure, not hurting the gums. Brush all sides including the chewing surfaces of all teeth. To clean the inside surface of your front teeth, tilt the brush vertically and make several up and down strokes. And finally, brush your tongue to remove bacteria and keep your breath fresh. Use a fluoride toothpaste with the ADA seal and replace your brush every 3 to 4 months. Sooner if the bristles get frayed. Brush twice a day, floss once a day, and see your dentist regularly. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
All right, so I'm gonna try to switch my screen back here. Bear with me for one moment. So I just briefly wanted to go over what the ADA recommends. So anything with the ADA seal you can consider safe. Okay, the ADA stands for the American Dental Association, and they approve certain products that they believe are safe and assured. They've been evaluated for safety and effectiveness so that you don't have to worry about it harming your body. If you do not see this seal, there's no way to know for sure if this is acceptable for you to be using. And I support whatever the ADA recommends. So what are their recommendations? We recommend you brush twice a day for 2 minutes. That's 120 seconds. This one, I talk to my patients all the time. You don't brush long enough. You're so fast, the plaque is building up on your teeth, is causing bad breath, and then you get teeth loss and periodontal loss. And so what the main issue is in society is that we're always in a hurry. Please brush for 2 minutes. That's 30 seconds on the top, 30 seconds on the bottom, switch 30 seconds, 30 seconds. So you want to change your toothbrush every 3 to 4 months, or when the bristles get really matted or frayed. And then you also want to change your toothbrush if you've been sick. You cannot use that same toothbrush. You want to throw it out and get a new one, okay? And then you can either use a mechanical or powered or electrical, so that's fine. So what are the benefits? We recommend that you brush with a toothpaste that has fluoride in it. Fluoride is literally it's beneficial to teeth because it helps remineralize your weakened tooth enamel. Tooth enamel is the outer shell of your tooth that protects it. It slows down the loss of minerals from the enamel. It reverses early signs of tooth decay, and it can prevent the growth of harmful oral bacteria, which can lead to ulcers, cavities, and things of that nature. So you want a toothpaste with fluoride in it. So how do you care for your toothbrush? Why do we need to do this? We recommend that you don't share your toothbrush. Everybody's flora is different, and it could cause a reaction in your mouth, believe it or not. So you can pass bacteria that way. Use your toothbrush and make sure that you keep it clean. You want to rinse it. After each use, please rinse it with water and make sure there's no remaining paste or debris on that toothbrush. And when you store it, you want to store it upright because you want it to dry and you want it to air dry and drain. If you guys put it in your traveling cases, you're going to harbor bacteria on that toothbrush and you're going to transport that into your mouth. And again, that can cause infections and ulcers and things of that nature. So moving on, this is an example that I wanted to show you under an electron microscope. What does a toothbrush look like? You can see what a new one looks like when it's got lots of extensions and it's great. And then the old one where it's worn out, it's not really doing as much. Just want you to see that there is a difference between a new and an old toothbrush. So please replace it. So next, why should we use powered versus manual? I wanted to jump right into this because you can use a manual. It's cost effective and it's convenience. It's convenient. So you can use this, but powered has just been the new thing because it saves time. It tells you when you need to click to the next part of your mouth. You have increased speeds. You can adjust the pressure. You have Bluetooth capabilities. You can see how it has increased efficiency 100%. I see my patients who use electrical versus manual, and all the time, the patient who brushes with a manual, powered, always has better hygiene. So it makes sense. You can monitor pressure, you can track your brushing habits, and you have different heads that you can use, which is a lot of fun if you like, using one for your tongue versus one for your teeth. So how do these toothbrushes perform? Toothbrushes, they have different multi-level bristles that can be angled, they can be flat. The angled brushes, the bristles perform better than your flat bristles. So if it's flat, the ones at the dollar store, it's gonna do a job, but not as good as angled, because angled can get into the crevices between your gums and your tooth. And that's exactly where you want those bristles to go. The ADA actually recommends you use a toothbrush that is soft. I do not even understand why they sell hard or medium. You think that's what you need to brush harder, But in fact, you only need a soft bristle brush. You just have to brush longer because it's like washing pots and pans with grease. You can't just rinse over it and the grease and the stain is gone. You have to sit there and rub that soap into it. And that's exactly what happens with your teeth and why you need to brush longer so that you're not building this plaque up. So when it comes to powered toothbrushes, because I'm going to focus on powered toothbrushes because that's just the new thing, there's different types of head movements. And here on the right, you can like appreciate all the technology that scientists have put into understanding how the tooth is shaped and how we need to brush our teeth effectively. And so they can move side to side, counter oscillations, circular, and ultrasonic is just a vibration. So it's doing something, but not as much as your circular heads that are actually moving as it's moving. Some of your most common brands are Oral-B that you'll see on every shelf, Sonicare, and Colgate. Your other brands I didn't focus on because they're independently owned and all these different things. You don't have to roll with these brands, but I'm just here to tell you, if you ask somebody, they're going to name one of these toothbrushes. To me, 7 out of 10 people own one of these type of brands, maybe not this brush. And these are your top most common brands you'll see. I wanted to compare Sonicare to Oral-B because this is the one question that I get all the time. What do you prefer? Who does it better? Let me just tell you, Sonicare, to me, I'll tell you, it has 4 different cleaning modes, which is clean, white, gum health, and deep clean. So you can like switch the power on the handle, right? And it has 3 different intensities to choose from. Well, Oral-B has 6 different settings, and I'm not gonna list all those that are there. And it also has a tongue clean. And it also has different intensities. So they both do pretty much the same thing, but one looks a little sleeker than the other, but the other to me is more effective. But I wanted to give you the facts, and this is directly from their website, their modes, so that you can see what the huge difference is between the two. Now, both toothbrushes both have the Bluetooth feature. If you don't have one of these toothbrushes, I'm just gonna go over what it can do for you. It will tell you how long you brushed, and how long you spent, and what you do from day to week to month. And it will do a summary for you on how you've done. So if you're not sure if you're brushing long enough, a Bluetooth compatible toothbrush will actually monitor that for you. You can pull up the app on your phone and say, did I brush long enough today? Yeah, that's a lot, but that's pretty much what it comes down to. Now, going back to the Sonicare and the Oral-B toothbrush, Sonicare, in my opinion, gives you the Lexus feel. If we're talking cars, it's luxury because it's sleek. It's really nice to look at. It has all these nice features. You have a glass to hold it charges the toothbrush in a glass. I think I have a picture here. You can see here there's a glass. I have this toothbrush. I've received these to critique them and get my opinion. I like it for the sleekness, and I like the glass because I can swish my water and things of that nature. However, the Oral-B toothbrush, you can appreciate the shapes of the heads are different, and they in fact actually, Oral-B's heads rotate in a circle, and my husband and I have gone back and forth, and he agrees that Oral-B is in fact more efficient and it removes more plaque quicker. And I think Sonicare can do the same thing, but the head just vibrates. If you can see my hand, it does this motion, whereas Oral-B's heads are actually moving if you get that particular head. And it also does ultrasonic vibrations as well, but it does a combination of all of those. And so that's my opinion about when it comes to Oral-B versus Sonicare brushes. Now, the last one, I'm sorry, on the bottom there is a Colgate toothbrush. These work fine. I'm not saying you cannot use these. All I'm saying is your top brands have all these other features. Colgate, you turn it on, it's battery powered, it's more cost effective. It's gonna vibrate, but it's not gonna give you the Bluetooth compatibility. You can't change out the head. You've gotta change the battery. You gotta remember to do it. Your Oral-B and your Sonicare, you plug it into the wall and you put it on this charging station and you don't have to worry about replacing it. It will last you. So moving on to the Bluetooth features, I was saying, I feel like this is one of the new technologies for those of you who are struggling with your hygiene. you're going to probably want to consider a Bluetooth toothbrush because it'll let you know where you're struggling and where you're doing well and where you're not. So this pretty much sums up brushes because they have different heads, different modes, different strengths, different intensities, how they're going to remove plaque off of your teeth. But one way or another, you can do it with a manual toothbrush or you can do it with an electrical toothbrush. It's really all in preference. I will say this, electrical toothbrushes I recommend to all of my elderly patients who have dexterity problems. They can't really hold the brush and move it, but if electrical, they can just hold it in their mouth and just glide it. Okay, that is an added benefit of an electrical toothbrush. If you're lazy, you need an electrical toothbrush. It's gonna time it for you. It's gonna beep when it's time to move to the next side. You don't have to worry about it. And a manual, you gotta think about it. So these are all of my references here from the things I've talked about. I really wanted to leave time for you guys to ask questions about brushing and why do we have to do it and things of that nature. Take a picture of the screenshot. The ADA has really been my main source. Everything that we recommend is everything I explain to my patients on a regular basis. So this time, I have a giveaway for you guys, for those viewers. The way you can enter into this giveaway, this is the Oral-B Genius X. And this is my favorite toothbrush. I've tried Sonicare. They've sent me 5 brushes and I like the way it looks, but this Oral-B is hands down really cleans my teeth to where it just feels like porcelain when I glide my tongue across and it doesn't miss spots. I think Sonicare, you're gonna wanna have to hold it a little longer. So if you want to enter into this giveaway, you please go over to our website. You have to subscribe to our email. You can scroll down to the bottom and type in your email, or in our contact page, you can do it there as well. There's only gonna be one winner. And this is valued at $180. I went on Target's website and they have this toothbrush for $179. Now, if you go to your dentist, they will probably offer it to you from anywhere between $120 and $135. I have not seen any dentist giving it any cheaper than that. If they are, they included it in your fee of your treatment and they just conglomerated the whole fee and it's in there somewhere in your line item. But this toothbrush has a lot to offer. And so I have it here with me. Literally, this is the toothbrush that you will be receiving if you are to win our giveaway. So head on over and do that. I promise you, you will never go back to any other toothbrush. I feel like you will absolutely adore it and you probably will want your entire family to have it. So I want to say thank you at this time to everyone that's tuning in right now. I know it's a lot going on, but thank you for just taking your Saturday night and spending it with me. If you have any questions about anything I've talked about tonight, please go ahead and type it in the chat box. And I want to go ahead and get started and answer any questions that you could possibly have about the session that we had tonight. So are there any questions about anything that I've discussed with you guys on tonight? No yearning questions? All right. I'm just now seeing the chat that says you guys couldn't see the video earlier. I apologize. Can you give recommendations to help with whitening your teeth? Absolutely. Me and my husband had this conversation today, actually. What I will recommend, every patient is different. Your level of sensitivity will vary depending on your natural genetic makeup of your tooth structure. If you are looking for something cost effective, I have used Crest White strips and have seen an improvement. It is very slow improvement, okay? Because they have like a 10-day, a 20-day, and a 30-day, I think, unless they've changed the packaging. But it's a very slow whitening, okay? And I've heard from different patients that they get some sensitivity with Crest White. So be very careful not to do too many sessions of that. I think I only did one round and I was like, okay, my teeth are definitely whiter, but they're not stark white. The Crest White strips do work. If you become sensitive, discontinue, Okay. And when you become sensitive, you're going to want to make sure you have a toothpaste and a mouthwash with fluoride in it. I tell all of my patients, whether they have braces or not, to use ACT. 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 ACT has a high level of fluoride in it, and it basically helps remineralize your enamel, which is the tooth structure that becomes sensitive and why you start feeling sensitivity, because the enamel is thinning and it's causing sensitivity. So you need to restore that tooth strength, and fluoride does that for you. If you don't use Crest White strips, I recommend Zoom whitening. My husband has done a series of those whitenings, and his teeth are absolutely gorgeous. He loves it. He swears by it. It is only done by professionals in a dental office. Zoom whitening, it's a procedure that is done in office. It can take anywhere between 45 minutes to an hour and 30, depending on how many shades of white you're trying to achieve. So they'll do a session, clean the teeth off, let you look, and then do another session. The price for that varies depending on what state you're in. I will say it anywhere from $200 to $400 for Zoom whitening. So I hope that answers your question with your whitening. What do you recommend for youth teeth? I really like Crest Kids and ACT for kids. Definitely, kids really need a certain level of fluoride, and they're not brushing properly. We know they're not. So as long as they have something with fluoride in it and a mouthwash with fluoride in it, you're going to be good to go. And you want to try to encourage them to brush, but if anything, make sure they're swishing and try to wipe their teeth. If you're not around a toothbrush, take a napkin or a towel and just wipe that film off of their teeth. And try not to let them go to bed with anything, candy, bottles. It's just a no-no. You're really setting your child up for having bad teeth in the future if you do that. How often should you update the electrical toothbrush, the device itself? Honestly, I think you only have to update it depending on your level of comfort. I mean, your toothbrush can last forever. You need to change your heads every 3 to 4 months. Those heads wear out. The bacteria builds up. It gets to the point where they're so thin, it's brushing, but if you got a new one, it could do it more efficiently and effectively for you. So every 3 to 4 months, change that head and don't worry about changing the brush. The next question says, does the Sonicare toothbrush also clean the tongue well? If not, what do you recommend? Absolutely. Sonicare will clean the tongue as well. I just like Oral-B's head that oscillates in a circle, so it's on my teeth and it's moving like this, and Sonicare is just vibrating. So I just think Oral-B just is more effective, but all of your toothbrushes work fine on the tongue. The problem is a lot of people don't even brush their tongue. They forget all about it, and this is where halitosis comes in and bad breath. So just brush your tongue. Yes, you probably will gag. I think honestly I gag every time I brush because I'm either in a hurry and it goes too far down my throat. Just as long as you don't make yourself vomit, but you do want to hold your tongue and make sure you're scrubbing it and when you are doing your routine on a day-to-day basis. The next question I have is, charcoal toothpaste solutions, is this healthy? I have to be honest with you guys, every dentist is going to give you a different answer. So I have to give you what I believe and what I think about charcoal. Charcoal is very abrasive, meaning it's rough. It's almost like sandpapering your teeth. So yes, it will clean your teeth. And yes, it will be white. The problem that I have with charcoal that I do not like is that charcoal, because it's so abrasive and gritty, the black charcoal can get down into your gums if you're not rinsing. And so those tiny little particles creep down into between the gum and your tooth. So this is your tooth and your gum is right against it. The charcoal can get down in between there, and then you can have staining and then some inflammation because your body's trying to rid itself of this particle, but your toothbrush can't get down into the crevice. So I don't like the fact that it has the long-term effects of it can be detrimental. Initially, it's great. I mean, it's a quick way to get your teeth white, but would you want to continue to use this forever for whitening your teeth? I don't think so. And so I'm sorry. I think it's okay if you're going to do it once or twice. I just don't think it's one of those things you want to do because of the particles that can be left behind, and you cannot rinse it. So I have a next question. I have sensitive teeth, and what would you recommend to help with that? Sensitive teeth, I do too. I use Sensodyne every now and again, but if you are really sensitive, you're gonna wanna stick with Sensodyne. That is the only toothpaste that I have routinely. When I say routinely, I offer it at least 4 times a week to somebody who's sensitive. And when they come back, they all have improved. Now, sensitivity, you can have sensitivity if you have a cavity. No toothpaste can correct that, okay? If you have a cavity and you don't know it and your tooth is still aching from hot, cold, sweet, you need to see a dentist, because more than likely you need some type of restoration to get rid of the decay, clean it out so the tooth can stop being sensitive and be restored. Your dentist will tell you if the cavity is restorable or if you need a root canal and a crown. That's a whole nother story. So I don't want to sit here and say, yeah, Sensodyne is going to cure all sensitivity. Absolutely not. If you have a cavity, you must have that filled. The next question is, does the Sonicare, do you have a preference of over Colgate and Crest? Oh, yay. Thanks for asking that question. My husband and I had a family member call us and ask us this question recently, actually. The difference between Colgate and Crest is very minimal. You have to decide, it's going to be literally like picking out a perfume. You like the smell of this perfume. You like that it's strong. You like that it's soft, it's sweet. And Colgate and Crest have different flavors. And some of them are like grainy and some of them are smooth. So you kind of have to test out toothpaste, almost how you test out driving a car. It really is going to depend on what flavors you like. I don't really care for the cinnamon and stuff like that. I like the minty. I'm a 3D white Crest girl. I have tons of it. Every time I get samples, I'm storing it and trying to give it to my friends and family because I like 3D white. The only other difference between the two, be careful. One of the toothpastes for some individuals can cause what's called a sloughing of tissue, where it turns white and it looks like the skin is peeling on the inside of your mouth. That's because that means the toothpaste is too harsh. I have seen this in my clinic about 3 or 4 times, and every time I've recommended the patient to change their toothpaste, it has cured it and it went away and it never came back. But it looks white and it looks like you have white lines on the inside of your mouth and it looks like your skin is literally peeling. It's called sloughing. It's because the toothpaste is too strong for you. And the times that I've seen it, unfortunately, it was Crest. But I use Crest and it doesn't really bother me. So please be careful with that. Anytime you guys see a sloughing or a white and it's burning, stop all use. You cannot use that anymore because your body simply just cannot handle it. So the other question, is charcoal toothpaste effective? Yes, I think I answered this earlier. I'll say it again. It's very effective. It's a quick way to whiten your teeth. The problem with charcoal is the tiny particles can get embedded in your gum tissue and can cause problems in the long term. Should children get sealants? Are they safe? Oh, absolutely. My children, without a doubt, will have sealants. There's no questions asked about it. If you are wondering if your children should have it, the sealants help seal the tooth from the risk of getting cavities. So our teeth have what are called grooves. So you feel if you run your tongue over your teeth, you can feel these bumps and humps. That means it has these grooves and fissures. The food gets down into those grooves, and for whatever reason, our toothbrushes really just can't get there. So unless you're brushing really good after every meal and rinsing, you leave food there over time, and the decay just happens. What does a sealant do? Sealants fill in those grooves and fissures so that the food can't even creep down into those deep grooves that your toothbrush can't get to, and you don't have to worry about that risk factor of causing cavities. So that just completely eliminates it. So we recommend it for all your back teeth. They don't really recommend sealants for adults anymore because at that point, it's probably too far gone and they'll do something similar to a sealant. Your dentist will probably recommend, it's a procedure that's similar to a sealant, but it's no longer called a sealant at that point. Sealant is strictly a term used for pediatric dentists. And when you get into a general dentist office, they're calling it a restoration at that point, but they're simply just taking material and feeling in those grooves so that you can reduce your risk of developing a cavity. So I hope that answers all of you guys' questions. These have been great. I love the fact that these are questions me and my husband were just talking about. I believe this concludes all of our questions. I want to say thank you guys so much again for tuning in tonight. We have tomorrow night is our last session of the series, y'all. Tomorrow night, Jennifer Milton and Michaela Williamson will be doing a series on Self-Care Sunday. They're going to be talking about different ways that you can deal with your mental health and natural ways of glowing up and leveling up. Michaela is an organic chemist. She makes her own products. So she's just going to cover a few of those things that we'll talk about, the things you can use as an alternative to some of those over-the-counter products. So tomorrow night ends our series, ladies, but that is not the end of Glow Up, Level Up. Stay tuned. We will have more sessions that will come in the future. I believe it's going to be about a 2-week window because I'm in the process of creating new content. So stay tuned. If you please subscribe to our email, you will know when these new sessions will arise. I want to thank you guys again for tuning in tonight. And if you have any other questions, please feel free to email us. Thank you guys. Have a great Saturday night.
Gotta get in control. Level up and
Get your GULU t-shirt soon, guys.
You've got to know the road. Gotta get in control. Level up and let them know. You gotta know.
We believe that when you know, you will glow. So please tune in tomorrow night for our last session of our Women's Self-Care series. Thank you guys so much for your love and support. I appreciate you all. Have a good night.